Hello, my name is Kim Peters. I'm a student with Maryville University. I am here to do my health assessment video, my head-to-toe video, and this is my volunteer, Todd. He has agreed to have this done. If you could let me know during at any time if you have any pain or tenderness upon this exam. I first asked Todd to empty his bladder, change into some regular clothes. I wash my hands. Upon general inspection, I see that he is well nourished, he's appropriately dressed, he answered all of my questions appropriately. I saw that he had a steady, independent, and normal gait as he ambulated into the room. I checked his distance vision with the Snellen chart and his near vision with the Rosenbaum, which tests his cranial nerves. I'm first going to start with an inspection. I'm going to look at the head, the scalp, the eyes, the nose, and the mouth. I see that they are all symmetrically placed. They are midline. There seems to be no masses or any lesions. He has a uniform color. His hair is evenly distributed. There is no signs of alopecia. I'm now going to check and assess his facial nerves. Can you please wrinkle your forehead, squint your eyes, puff out your cheeks, smile, and stick out your tongue. All of those findings are symmetric on both sides, and he did those without difficulty. I'm now going to palpate. I'm first going to palpate the scalp. I see that there are no indentions, there's no masses, no lesions, there is no swelling. The scalp is freely movable, and I'm noting the texture of his hair. I am also going to palpate the facial bones. I'm going to note that there is no edema, no sensation. There are no masses or lesions. I'm also going to check the TMJ joint. Open, close, side to side. There is no popping, clicking, or tenderness. I'm now going to palpate the sinuses. I will first do the frontal sinuses and the maxillary sinuses, and I will note that there is no tenderness and no swelling. I'm now going to check light sensation. I'm going to do that with a Q-tip. I need you to close your eyes and tell me where you feel this.
Forehead, cheek, other cheek, chin, nose.
Okay, did you feel those evenly or more on one side than the other?
Evenly.
Okay, he had appropriate light sensation. I'm now going to inspect the eyes. I notice that the eyelids close normally. There's no redness, no drainage. I see that his eyelashes are normal. They grow upward and outward. I see that the eyebrows are symmetric. The hair is distributed evenly. I'm now going to palpate the lacrimal apparatus. You can see that there is no hardness, there is no tenderness, and there is no drainage as I palpate those. I am now going to look at the sclera and the conjunctiva. There is no redness, no swelling, no drainage. Those are all normal findings. I am now going to check the pupillary response. I am going to do this with direct and consensual examination with a pen light. First, I'm going to do direct. Now consensual. I can see that the pupils reacted accordingly. They are equal, round, and reactive to light and accommodation. There was appropriate accommodation and constriction with the consensual and the direct examination. I'm now going to do the cover, uncover test. Cover your right eye. Uncover. Cover your left eye. Uncover. There was no extraocular movements. There was no nystagmus. And there was no jerking. Now I'm going to check your visual fields. I need you to follow my pen light. I need you to follow it with your eyes and not with your head. I'm noting upon this examination that there are no extraocular movements. There's no jerking. All of the movements are smooth and looks really good. I need you to cover your right eye. I'm now going to check your peripheral vision. Let me know when you can see my fingers in your view.
Now. Now. Now.
The other side.
Now. Now. Now.
Peripheral vision was correct bilaterally. I'm now going to check the ears. I'm first going to start off with inspection. I see that they are aligned properly. They are not low set. I'm seeing that there are no masses. The auricles are close to the skull. Now I'm going to palpate the auricles. I'm feeling that there are no masses, no lesions. Now I am going to do the whisper test. I need you to cover your right ear. I'm going to whisper a word, and I want you to tell me what you hear.
Orange.
Now do your other ear.
Apple.
He heard both words appropriately. That helps to check the acoustic nerve. Both sides were normal findings. I'm now going to inspect the ear canal with my otoscope. I'm going to pull the auricle up and back. I can see that the ear canal is clear. There is no drainage, no redness, no swelling. I see the tympanic membrane is pearly gray. I see all of the bony structures, and I can see an effective cone of light. There was no bulging. I'm now going to check the hearing. I'm going to do air conduction and bone conduction. I'm going to first start out with the Weber test. I'm going to strike the tuning fork. I'm going to put it on top of your head. Tell me if you hear it better in either ear or if it is even.
Even.
Okay, I'm now going to do the Renee test. I'm going to strike the tuning fork. I'm going to put it on your mastoid bone behind your ear. I need you to tell me when you can no longer hear the sound. Then I'm going to move it to the front of your ear to check the air conduction, and you let me know when you can no longer hear that.
Now. Now.
That is a normal finding. The air conduction is about twice as long as the bone conduction, which is a normal finding. I am now going to inspect the nose. I need you to lean your head back for me. I'm going to look with a pen light, and I see that the mucosa and the turbinates are normal. Everything is pink and moist. There is no drainage. The septum is midline. There is no perforation. I'm now going to check the patency. Can you please close one of your nostrils and sniff and check the other side? Were those evenly?
Yes.
Those were found to be patent evenly bilaterally. I'm now going to inspect the mouth and the lips. I see that the lips are full and pink and moist. There is no cracking, no fissures, no signs of trauma or any lesions. I'm now going to inspect the buccal mucosa, the gums, the hard and soft palate, the floor of the mouth, and the tongue. Open up your mouth. I can see that the inside of the mouth is pink and moist. There's no lesions. It's smooth. I can see the uvula is midline. The teeth are white with no debris. There are missing teeth that we discussed in the health intake due to gum disease. The teeth that are left have no cracks or breaking, and they all look to be pretty good. Please stick out your tongue. Move to the left and move it to the right, and lift your tongue up. I'm looking at the floor of the mouth and the sides of the tongue. There are no signs of lesions or any oral cancer. Everything seems to be smooth. Now I need you to stick out your tongue and say ah.
Ah.
And I see that the uvula raises appropriately with the soft palate. Now I'm going to elicit the gag reflex. And that shows cranial nerve function, and that was appropriate because I did elicit the gag reflex. I looked at the oral pharynx, the pillars, the uvula, the tonsils, the posterior pharynx, and everything was appropriate with no lesions, no redness, no swelling, and I noticed that there was no odor. I am now going to inspect the neck. I can see that there, with tension of the lighting, that there is no jugular vein distension. I see no abnormal pulsation. I see that there are no masses, no lesions. The color is uniform. I can see that the trachea is midline. I don't see any signs of a goiter. I'm now going to check his range of motion. Please lean your head back, forward, turn it to the right, turn it to the left, put your ear to your shoulder, the other side, shrug your shoulders. Okay, I'm now going to check strength and resistance. Please turn your head. Okay, the strength, and he was able to resist somewhat, so that shows normal strength and no abnormalities. I am now going to palpate. I'm palpating the trachea. It is midline. It is rigid. There is no mass. There is no sign of a goiter. Now I'm going to have you swallow. The thyroid is smooth. When he swallowed, it rose appropriately and bilaterally. I'm now going to palpate the carotids. I'm going to do those one at a time. Has a regular rate and rhythm, no abnormal pulsations. I am now going to check the lymph nodes. I am first going to start out with the pre-auricle, the post-auricle, the occipital, the tonsillar, the submandibular, the submental, the superficial cervical, the posterior cervical, and the deep cervical. I'm going to check the supraclavicular. Okay, I'm now going to auscultate the thyroid and the carotid arteries. I hear no turbulent blood flow. I hear no bruise. I hear nothing abnormal. I'm now going to inspect the hands, the arms, and the shoulder. I'm seeing that the color is uniform on both sides. There are no masses, no lesions, no rashes, no signs of trauma. I see that the color is warm. I feel no lumps or masses. I'm looking at the fingers. I see no signs of cyanosis or clubbing. I see that the capillary refill time is less than 3 seconds, which is a normal finding. I'm going to check the brachial pulse and the radial pulse. And those are normal bilaterally. They're felt the same on both sides. There's no difference between the right or the left. I'm now going to have you to turn this way so that I can inspect your back and posterior chest and lungs. I can see that the thoracic configuration is normal. The AP diameter is 2 to 1. I can see the respiratory rate. There is normal. It rises normally on both sides. There's no labored breathing. I'm going to check the costovertebral angle for tenderness. I'm also going to check the thoracic expansion. I'm going to put my thumbs on both sides of his spine, and with an inspiration, I'm going to make sure that it expands correctly. Take a deep breath. And my thumbs moved appropriately. I am now going to examine to see even unlabored breathing. I'm going to check for tactile firmitus. Whenever I put my hands, you feel my hands touch your back, please repeat the phrase 99.
99, 99, 99, 99.
There were no abnormal or decreased vibrations. That is a normal finding. I'm now going to percuss for thoracic expansion, or for diaphragmic excursion. I'm going to start from the top. I'm looking for a difference in sound. And I see that that is a normal finding. It is within the normal limits of the 3 to 5 centimeters. I'm also going to percuss to make sure that there is resonance. I'm going to do that from side to side. And there are no abnormal findings. I'm now going to auscultate the posterior chest and lateral. Oh, no, let me do that first. I'm going to listen to the lung sounds. Take a deep breath. Okay, goes to the side. Okay. There were no adventitious lung sounds. There were no rales, no rhonchi, no wheezes. Okay, I'm going to have you to move to the front. I am now going to inspect the chest. I can see that it is uniform in color. There are no masses, no lesions, no rashes, no bumps, no bruises. I do not see any labored breathing. I see that the respiratory effort is normal. There's no pulsations, no heaving. I'm going to palpate the chest wall and the pericardium. I feel no thrills, no heaves, no abnormal pulsations. I'm going to, while I'm here, check the infraclavicular lymph nodes. I'm also going to check the axillary lymph nodes. They are freely movable. I feel no abnormal masses. There is no warmth, no pain or tenderness. I am going to check for tactile firmitus. Please repeat the phrase 99 whenever you feel my hands.
99, 99, 99, 99.
There are no abnormal decrease in vibration. It is a normal finding. I can see that the breathing is unlabored. I'm now going to percuss. Let me check the apical impulse. Okay, that's normal. I'm now going to percuss from side to side, bilaterally. There are no abnormal findings. I'm now going to auscultate the breath sounds, then the heart sounds. Now I'm going to listen to the heart sounds. I'm going to start with the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral valve, or mitral area. There were no abnormal heart sounds. I heard S1, S2 normally. There was a regular rate and rhythm. No signs of a murmur or any abnormal beats. I am now going to check your arm strength. If you could extend your arms out, push up, push down, push outward and inward. Strength was normal bilaterally. If you could lay down, I'm going to check your abdomen. Okay, I'm now going to inspect the abdomen. I see that there are no abnormal pulsations. The hair distribution is normal. The skin color is normal. I see no masses, rashes, or lesions. I am now going to auscultate the vowel sounds in all 4 quadrants. Sometimes you may have to listen up to 2 minutes in each area to hear vowel sounds. You to note the characteristics and if they and the activity. I'm now going to listen to the aorta. I hear no abnormal blood flow or turbulent blood flow. I'm going to listen to the renal arteries. I'm going to listen to the iliac. And then next I'm going to listen to the femorals. And there are no abnormal findings. I'm now going to percuss the abdomen for tone. I'm going to try to locate the liver and the spleen by the dullness with the percussion. Okay, so I'm going to locate the spleen and hear the dullness, and now I'm going to do the liver. I'm going to start from the bottom. Since I have located the spleen on percussion, I'm going to lightly palpate. I'm going to check the aorta. I feel no abnormal pulsation as I am checking, doing light palpation. I can feel no masses. I can feel no lumps. Could you lean your head up for me? Okay, there's no sign of a hernia. The abdominal muscles are within normal limits. And now I'm going to try to palpate the spleen. Okay, I cannot feel that. Now I'm going to palpate deeply and feel the liver. Okay, it's smooth. I'm now going to palpate deeply for the kidneys, put one hand underneath and one on top. Okay. I feel no abnormalities, no masses, no lumps. Okay, I am now going to check the legs. I am doing an inspection. I see that the muscle tone is the same bilaterally. I see that there is even color and even hair distribution. I can see no masses, rashes, or lesions. I'm going to palpate. I see no signs of edema and feel no masses or lumps. I'm now going to check the pulses. I'm first going to check the popliteal, the tibial, and the pedal pulses. And those are normal bilaterally. I am now going to check your sensation. I'm going to check your cranial nerves. I'm going to do dull and sharp sensation. This is sharp. This is dull.
Dull, sharp, dull, sharp, dull, sharp, dull, sharp.
His sensation is normal bilaterally. I am going to check your reflexes, if you could sit up for me. And I'm also going to check the strength when he is in this position as well. I'm going to check the reflexes. First, I'm going to do the knee reflex. Those were found to be appropriate bilaterally. I'm now going to check the Achilles. Both reflexes were found to be normal. I am now going to check your strength. Please push against me. Okay, pull forward, backwards, and now push forward. There was found to be no abnormality in his strength, and he resisted me correctly. I'm now going to have you stand up. I'm going to have you bend forward so I can check your lumbar spine. Please bend forward. Lean backwards. Turn your trunk from side to side. He is found to have full range of motion. Thank you. That is the end of my exam.